Hi everyone, and welcome back again to my channel. Today I'm going to talk about uterine fibroids, which has become a major and a common condition in women of childbearing age and above 45 years. Uterine fibroids are benign or non-cancerous tumors of muscle tissues in the uterus, and they are also called myomas or leiomyomas. Fibroids occur when a single muscle cell in the wall of the uterus multiplies and grows to form an uncancerous tumor. Fibroids can change the shape or the size of the uterus and sometimes the cervix, that is the lower part of the uterus. So women usually have more than one fibroid tumor, but single fibroids are also possible. And whether fibroids cause symptoms or require treatment depends on their location, size, and number. Fibroids are usually found in or around the body of the uterus, but sometimes they can be found in the cervix. So in this case, there are three main types of fibroids based on where they are located. The first one is subserosal fibroids, which are found in the outer wall of the uterus, and they occur in about 55% of women. The second one is called intramural, and they are found in the muscular layers of the uterine wall, and these happen in 40% of women. Submucosal fibroids protrude into the uterine cavity, and this happens in just 5% of women. Fibroids can also be connected to the uterus by a stalk or pedunculated or attached to nearby ligaments or organs such as the bladder and the bowel. Fibroids are rarely outside the pelvic cavity. The exact cause of fibroids is unknown or unclear, but there is evidence that it may be a combination of genetic, hormonal, and environmental factors. So in most cases, one of the main question that many would ask is, can fibroids decrease fertility? In approximately 5% to 10% of infertile women have fibroids. Their size and location determines whether fibroids affect fertility. Examples include fibroids that are inside the uterine cavity, those are the submucosal fibroids, or very large fibroids above 6 centimeters in diameter within the wall of the uterus, that is the intramural fibroids. But in most cases, most women with fibroids will not be infertile. So it is recommended that women with fibroids and their partners should be thoroughly evaluated to find other problems with fertility before fibroids are treated. A fertility specialist can help assess if fibroids might be hampering the conception. How do fibroids cause infertility? That would be another question mostly asked. So there are several ways uterine fibroids can reduce fertility. Changes in the shape of the cervix can affect the number of sperm that can enter the uterus. Changes in the shape of the uterus can interfere with the movement of the sperm or the embryo. Fallopian tubes can also be blocked by fibroids, and fibroids can also impact the size of the lining of the uterine cavity. Blood flow to the uterine cavity can also be affected, and this can decrease the ability of an embryo to stick or implant to the uterine wall or to develop. So what happens to fibroids during pregnancy? Fibroids are found in 2% to 12% of pregnant women, but not all fibroids get larger or cause problems in pregnancy. If a fibroid grows, it usually does so in the first 12 weeks of pregnancy. The biggest concern in pregnancy is whether the fibroid will increase the chance of preterm birth or miscarriage. And in some cases, fibroids can outgrow their blood supply and cause severe pain. And in this case, hospitalization might be needed. Also, fibroids can change the baby's position in the uterus, and this can increase the risk for miscarriage, preterm delivery, and cesarean section. How fibroids are managed depends on your unique situation and your doctor's recommendations. Surgery is rarely necessary or performed during pregnancy to remove the fibroids. And if a woman conceives after having a fibroid removed, she should discuss this with the obstetrician who will deliver the baby. A cesarean section may be recommended in this case. So in summary, uterine fibroids are common and can affect fertility in many ways. They can affect whether the sperm and the ovum meet, can affect whether an embryo can implant, they can affect whether a pregnancy can continue, and they can affect the growth and positioning of the baby. Treatment is decided on a case-by-case basis. It is based on the symptoms of fibroids and may improve overall fertility. How and whether you treat your fibroids depends on the severity of your symptoms and your doctor's recommendations. Thank you for watching. Subscribe. Hope this video was informative. See you in the next one.